Hi guys, this is Dr. Bailey again. So one of the things that I really enjoy most about being a pediatrician, seeing new parents and they're coming in with their newborns and there are a flood of different questions and emotions. It's a very exciting time. And one of the most frequent question that I get is about bathing babies. Now, in the past, that really hadn't been an issue, but I know that there's been a lot of stuff on social media. So today I'm going to do a video that talks about the top 6 places as a new parent that you really need to focus on when you're bathing your baby. All right. These are things that can be missed. So even on exam, there are places where I'll see like a lot of skin cheese or smegma buildup, maybe rash formation. And so I just wanted to talk to you about these places that are really can't miss areas. All right, let's get started. Okay, so I have my trusty baby. All right, so first we're gonna start off at the head area. The most common place that I see missed is the scalp. And I know you're thinking, really, Dr. Bailey? But the babies have their newborn baby hair, right? It's pretty thin and the scalp is exposed. Really what I want you to do is when you are washing your child's hair, you're going to gently just massage in a circular motion on the scalp, right? With a little bit of baby shampoo, just gently. And what that's doing, if you just add just a little bit of pressure to it, it's just more stimulating follicles to help that hair grow. Even though honestly at around 5 or 6 months, it will fall out in places, and this is natural, but still it will also help. Now, what it will also help to do is the scalp itself. There is skin buildup, there can be even flakes, in some cases cradle cap. So if you're seeing any sort of scaly rash that's on your child's head, you just want to let your pediatrician know. And again, we also have another video on how to treat a cradle cap. Okay, so the second place that I always get asked about is cleaning the ears, right? Now, as a new parent, a lot of parents are just like, look, I have this little baby. I don't understand. Why can't I take a Q-tip and just stick it into the ear? One, no, please don't do that. The ears are actually too small. The canal is tiny, right? As a pediatrician, I don't need you to take a Q-tip or clean the canal. What I need you to do is just get out around the outer part of the ear itself, right? There we go. The auricle. Or what you can do is actually get behind the ear as well. Just clean behind the ears and also all this nice area here, okay? That's what I want you to do. So again, I'll show you with my other finger. So right in this area here, and then also behind the ears as well. And all you need to do is just take a washcloth and just gently clean. Okay, you don't need to really get in there and scrub. Don't do anything because your baby's skin is gentle and you want to treat it very gently. Okay, the next spot that is so important is the neck. Okay, so this is a doll, we know this, but as your baby gets older and hopefully larger and fatter, this is normal, right? So babies are going to get bigger heads and they get tons of fat, and all this fat comes into here. So they'll have like 4 or 5 necks. This is perfect. This is what we want to see as pediatricians, right? This is part of their progression and growth. However, in terms of cleaning, what you want to make sure of is that you get in between those neck folds, all of those neck folds, guys, because this is where a lot of the saliva, milk, any food or anything, this is where it pools up. And babies that are just really, really, larger or who have really hard to reach crevices, then what you do is you just take the baby and you just have them lay down. So when they lay down, their heads extend a little bit more, and then it's easier to get into those neck folds exposed, right? So that you can get in there and clean, and just gently clean. Now, another tip or trick that I wanna talk about is this. You know your baby is going to drool at a certain point, right? So bibs work really well. You put them here and they soak up a lot of that saliva, milk, whatever extra liquids are in here, even sweat, right? But to really help protect the skin, I really recommend something like a petroleum jelly. So take either Vaseline, Aquaphor, and what you're going to do is you're just going to, after you clean your baby's neck and in between those neck folds, you're going to apply Vaseline in those folds. And what that does is it protects the skin, right? So if your baby's drooling, the drool will come down, yes, but it's not gonna sit and pool in the neck folds because it's already protected by petroleum jelly. So just make sure if your child is drooling a lot, especially as they get older, use a bib, yes, but definitely use petroleum every time you're changing, you're bathing them, because it's really gonna go a long way. Okay, so this doll is not anatomically correct, but she's definitely made for social media. Anyway, what I want you to do, especially in girls, so we're going to talk about the private area, the diaper area, because this is so important. Okay, so in girls, what I want you to do is, one, you're going to make sure that the baby's vulva, right, is properly cleaned. So those are the lips. So essentially what you're going to do is just wash gently over the vulva. You're going to make sure that the creases in here, right, and in here where the vagina is laying is nice and clean as well, so nothing building up. Now, in babies that have larger lips and even those that don't, you're going to make sure that you kind of gently pull back the vulva, and you want to make sure that there's nothing in those creases. What you're going to see is more like a white cheese or that kind of buildup. What I want you to do is just take a washcloth and you're gently going to clean in those creases on both sides. You don't want any buildup. Sometimes I see stool in there. Sometimes I see that kind of white dead skin, like I said, buildup. You definitely just want to wipe it out. Now, I know that there are a lot of parents that are very hesitant, right? You have people who are like, well, I don't want to be seen as doing anything inappropriate. Your baby will thank you. If you let that stuff build up over time, it becomes a yeast infection. It's going to be a fungal infection. It's going to be really infected. It could get really irritated. Either way, you're going to have a baby that's crying nonstop. So save yourself the time, give your baby loving care, okay? And make sure to clean in those crevices. Now for boys, same thing, similar thing. All right, so what you want to do is for circumcised boys, so when you have just right at the head of the penis, you want to make sure that just in between the foreskin gently, that there's no cheese or anything built up or dead skin cells that you see, and that would again be that whitish kind of like cream cheesy stuff. So that's what you want to make sure of, that as you're going around the head of the penis, where the foreskin is, where they're meeting, that there's nothing built up, and you can just gently clean around there. Now, in boys that are uncircumcised, please leave the penis alone, okay? It's in its own environment, it's protected. I have a lot of parents who are just like, I was retracting it, Dr. Bailey, and I was pulling it back and cleaning and make sure it's clean. Please don't. Okay, it is just fine. But here's what happens. As you keep retracting the foreskin again and again, especially in an uncircumcised penis, that can increase that risk of penile adhesions, and that can be so painful for the baby. That's where the skin adheres to the skin itself. So it's really where the head of the penis adheres to the foreskin, and that can be so painful for your baby. So please do not retract the foreskin. Now, another tip, your baby's testicles hang low, which is true. You want to make sure that you get right up under there. So if the testicles are larger, you just want to make sure that you lift them up just gently and just clean under that area as well, because that's where things can pool. All right. Okay, so I have my good old baby safe, social media safe doll here again. So I need you guys to use your imagination. So if this is the baby's backside and we have that crease going up with butt cheeks on both sides, right at the top here is a little, you may have a little indent like for your baby, hopefully not a hole. If you have a hole, please let your pediatrician know immediately. But there may be a little bit of like an indent. That's where I also see a lot of things that just kind of pool in there. So if babies are having blowouts or what have you, you just want to get in there and just make sure it's clean. Sometimes the little indent spot may be a little bit deeper, and in that case, you just want to use a gentle water bottle and then just gently put water in here to help clean it out. But this is a no miss area, because I've seen this also just really become irritated, infected, what have you, if parents just kind of leave it and just think that it's there. So especially if your baby has a blowout, make sure that you're getting in between the creases as well, and make sure that this little indentation, this spot, is actually tended to and cleaned. All right, and I would be remiss not to talk about that sixth area, under the arms, guys. Oh my goodness. So we've talked about how your baby drools. So think about this. Baby's drooling all day. It goes in the neck area, and sometimes it can go down here. It can go here. It can get caught up in these creases. Make sure you're getting under these arms. And again, as you know, babies still have tons of little skin folds and things. So you want to make extra sure, again, that you're getting in these underarm areas and in these skin creases. And just like the neck, just to protect from future drool, buildup, what have you, irritation, put a little petroleum jelly or Aquaphor under the arms as well. Okay, guys, so I hope that this helps. Again, these are things that I see every day, and I just had to let you know. I got to share with you just because it is so important. Now, in terms of the frequency of how often to wash your baby, look, it really varies. I would say in the first few days, especially if the umbilical cord hasn't fallen off, it's better to just sponge bathe instead of submerge. And when you are washing the umbilical cord or that area, you can just do it with a little soap and water. Do not put extra emphasis or force on it, and then just pat it dry. All right, let your pediatrician know, obviously, if it falls off and if there's any bleeding, any swelling, obviously, any foul discharge coming from the area. But these are just things to know about. So in terms of frequency of how often to wash your baby, it really varies. It varies with the environment, where you live, like, how often your baby, kind of soils or has wet and dirty diapers, if they're feeding a lot, drooling a lot, these all can change. And just so you know, you're going to find out as a parent, it can change from month to month, week to week. Your baby's going to change, and so is the amount of bathing that it's going to need as it expands its environment. So whether it is every other day, if it's once a day, it really depends. Now, as a parent and a pediatrician, I will say, once my child started going to daycare, I'm going to be honest with you, I would definitely give him a wipe down every day, because daycares are germ magnets. It's what they are supposed to do. You have a bunch of babies being pulled together. So if your baby's coming home, you want to change the clothes, make sure that they're well washed, and then just wash them down from head to toe. This will help them stop being kind of vectors of disease, but it's not going to fully stop it. But it's just something that you should know. All right, well, I hope this helped. For future information from us, please be sure to subscribe to our TikTok or our YouTube channels. We're also on Instagram as well. Or you can always go to our website at www.askpeds.com. Take care, guys. For more tips and tricks for your child's everyday health conundrums, subscribe to our YouTube channel and go to our website at www.askpeds.com.